Is it recording? I don't know. Okay. Welcome. All right. So my informative speech is on Sjögren syndrome. I have 3 people watching: McKenna, her sister Claire, and then my sister Iliana, who is there. Okay. So, what is one autoimmune disease that you have heard of? Rheumatoid arthritis, type 1 diabetes, psoriasis. According to Healthline, the number 1 most common autoimmune disease is type 1 diabetes, with Sjögren syndrome dropping in as number 9. Because it seems to not be a well-known autoimmune disease, how many people do you think this disorder affects in the United States? Well, according to the Sjögren's Foundation, 4 million Americans have Sjögren's. Although we don't hear about Sjögren syndrome as often as other autoimmune diseases, there are still lots of people who are unfortunately dealing with it. I was diagnosed with Sjögren syndrome in February of 2020. I have researched everything from symptoms to treatments in order to understand this disease I have never heard about. In order to educate others on this disease, I will first start with what exactly Sjögren syndrome is and how someone is diagnosed, as well as the causes. Then we'll go into the symptoms of this disease, and lastly, we will talk about treatments and how someone is able to live with Sjögren syndrome. According to Mayo Clinic, Sjögren syndrome is a disorder of your immune system identified by the most common symptoms, which are dry eyes and dry mouth. It is most accompanied by other autoimmune system diseases such as lupus, the sister disease to Sjögren syndrome, which according to Mayo Clinic, it is the autoimmune disease that involves your joints, skin, kidneys, blood cells, brain, heart, and lungs. Another autoimmune system disease that accompanies Sjögren's is rheumatoid arthritis. Sjögren syndrome is similar to these because it attacks your body's own cells and tissues. Certain genes may give you a higher risk of the disorder, but could be triggered by different infections such as a particular virus or strain of bacteria in Sjögren's. In Sjögren's, the mucous membranes and the moisture-creating glands in your eyes and mouth are usually affected first, which then results in your dry eyes and dry mouth. Due to the disease attacking your glands, it could eventually cause complications such as severe cavities, yeast infections in your mouth, and also vision problems. Other complications with the disease, which are very slim, include pneumonia, bronchitis, cancer of the lymph nodes, hepatitis, or psoriasis in your liver, or numbness in your hands and feet. Sjögren's typically affects people who are older than 40 years old, men who are able to get this disease, but women are more likely to be affected. Scientists are trying to understand why women are more likely to be diagnosed, but haven't found reliable evidence just yet. This syndrome can be very difficult to diagnose because people often have different signs or symptoms that show they have this disease. Some of the symptoms or signs also mimic different side effects from a number of medications. Once you have experienced what seems to be symptoms of Sjögren syndrome, you should talk to your doctor immediately so they are able to do the proper test. Doctors will do different blood tests in order to find out your diagnosis, including tests on your blood cells, the presence of antibodies common in Sjögren syndrome, inflammatory conditions, and also signs of liver or kidney problems. Eye tests are other tests that will help doctors find a diagnosis, one being the Schirmer tear test, which is the one with the filter paper, which is when a small piece of paper is placed under your bottom eyelid to measure the amount of tears you are producing. Another one is when a slit lamp is used. The doctor will put a drop in your eyes that will show them if your cornea is damaged. Doctors may also use a oscillogram, which is the bottom one, which is when a radioactive isotope is injected into your veins and is tracked over a course of an hour to see how long it takes to arrive at your salivary glands. Lastly, a biopsy may be done on your lips, which is the top right corner, to detect any inflammatory cells. This test includes a piece of tissue being removed from your salivary glands and looked under a microscope. According to Sjögren's Foundation, there are about 2.5 million patients in the United States that are currently undiagnosed, and it takes an average of 2.8 years in order to receive a diagnosis. Many of the symptoms for Sjögren syndrome are similar to side effects of different medications, as well as old age, other health conditions, and even allergies. Symptoms vary from person to person depending on their severity of their disease. The most common symptoms of Sjögren syndrome are dry eyes and dry mouth, which has been mentioned before. Other common symptoms may be fatigue and joint pain, but it could also include dry nose, which may cause nosebleeds, a change in taste or smell, neurological problems which could include loss of concentration, memory loss, dysautonomia, which is a malfunction of the autonomic nervous system, and headaches. Immune thrombocytopenia, or ITP, is another symptom of Sjögren's, which includes a low platelet count. According to Mayo Clinic, ITP is a disorder that leads to easy or excessive bruising and or bleeding. ITP is the cause of a low platelet count, which are the cells that help blood clot. Other symptoms of Sjögren's syndrome may include vaginal dryness as well as dry skin. More severe symptoms of Sjögren's syndrome may include the dysfunction of organs such as the kidneys, gastrointestinal system, blood vessels, lungs, liver, pancreas, and the central nervous system. Sjögren's patients also have a higher chance of developing a lymphoma, which is cancer that begins in the fighting cells of the immune system. There are many other symptoms of Sjögren's syndrome, but these are the ones that stick out the most to doctors. To see other symptoms, I recommend looking at the Sjögren's Syndrome Foundation website. Looking at all these symptoms, there are many different treatment plans for Sjögren's patients. Unfortunately, there is no cure for this disease, but there are medications that can help slow down the progression of other symptoms that may cause severe pain for the patient. According to the Sjögren's Foundation website, Sjögren's syndrome can be managed by some lifestyle changes that unfortunately cannot be managed by just one medication. Doctors often prescribe multiple medications to patients. This includes a mixture of prescribed medication as well as over-the-counter medications. Because patients go through different side effects of the disease, the amount of medications and the different types of medications can vary. Patients are sometimes prescribed the most used medications for Sjögren's patients, which is hydroxychloroquine. According to NHS Inform, it is shown to slow down the immune system's attack on the tear and saliva glands. It can also reduce muscle pain, joint pain, and stiffness. Side effects to this medication include nausea, skin rash, loss of appetite, stomach cramps, and vomiting. These are usually uncommon or mild effects. Hydroxychloroquine may also damage the retina, which could eventually affect your vision. Because of this, you have to make sure you have a regular eye exam at least once a year. Another medication that may be prescribed is pilocarpine. Pilocarpine is used to treat dry eyes and mouth. It stimulates the glands to produce more saliva and tears. Side effects to this medication may include hyperhidrosis, which is excessive sweating, nausea, heartburn, abdominal pain, and an increased need to go to the bathroom. Side effects may be mild for some patients, but some patients may experience side effects that outweigh the benefits. According to NHS Inform, often patients aren't prescribed medication but are told to use over-the-counter medications. Over-the-counter medications may include artificial tears, which are dry eye drops that are able to mimic tears. This is able to help with dry eyes. For dry mouth, there are different mouthwashes one is able to use. Patients are told to use sugar-free chewing gum in order to stimulate saliva, as well as increasing your fluid intake. Treating the symptom of dry skin, patients are told to use several soaps or creams designed for people with dry skin. For vaginal dryness, patients are told to use a lubricant or creams that contain estrogen. Lastly, for muscle and joint pains, there are over-the-counter medications such as ibuprofen that could help reduce joint pain. If the over-the-counter medication doesn't help, patients are told to ask their doctor about prescribed medication that is able to decrease pain. The NHS Inform website gives general advice for patients struggling with Sjögren's syndrome. The advice includes having a dental checkup every 6 months, practice good dental hygiene, which includes brushing, flossing, and using mouthwash, and avoid eating sweet foods. Avoid strong and perfumed soaps, avoid dry environments, and lastly, avoid drinking too much alcohol. There are many different treatments someone with Sjögren's syndrome is able to research in order to help with the pain they may be feeling from this disease. Sjögren's syndrome is an autoimmune disease that affects your glands and attacks the healthy cells in your body. There are many symptoms that come with Sjögren's syndrome and that look like other side effects of medication and other common things such as allergies that people go through. There are many different medications that may help with the symptoms of the disease. Not only can they be prescribed, but there are some that are over the counter as well. Although Sjögren's syndrome is not a well-known disease, there are many people who are suffering from it daily. The symptoms of this disease may not be visible, but it definitely shows you just because someone isn't showing signs of struggle, they may still be going through something internally. Hannah.
Yay!
Okay.